Thank you, thank you. What is it like to be me? Oh, okay. Well, that what is it like to be me? Well, I'm a very busy person. I'm a very most of my days are pretty active doing a bunch of different stuff. I'm a therapist, and so I end up helping people most of the day. So a lot of my days are spent listening to other people, hearing their stories, helping them through all the difficulties of life. So I'd say this week specifically has been a lot of listening and hearing people out. Yes, yes. So it is the same. Little differentiations. In the U.S., the LCSWs, we're like therapists. I have a private practice. I specialize in anxiety disorders, OCD, any of the uh, hoarding type of disorders, things like that, trauma. And so it's most of my patients come to me for those sorts of issues. Hmm. Yes. Yes, yes. We have a very broad spectrum of things we can do. As social workers, we can do anything from, you know, we can help with families who are in trouble. We can work for social service departments. And then there's the clinical side of things where some of us go for advanced training and advanced supervision to get to be able to basically be able to see people for like private practice. So we fall under like the therapist realm of things. And yeah, I'm also a writer. I'm also an artist. So I'd like to throw those things out there. I work with a lot of people who are in the arts and people who are, uh, artists themselves. And so, I try to have a nice little mix of things. And I'm also a writer. So I just wrote my first memoir, my life story basically. And it was about a condition that ultimately happened to me about a decade ago. I was able, well, a decade ago, was struggling with some anxiety, depression, saw a psychiatrist, and I ultimately got put on medication I probably shouldn't have gotten put on. And it was through that I ended up developing this movement disorder, because it was a side effect of the medication. So that is what my book is ultimately about. It's called Unstill, and it's really the journey of trying to find answers. Through this, finding doctors and answers as to what had happened and, how this thing would sort of impact me. A lot there. So, um, yes, but well, I'll get into the nuts and bolts of it. So basically, the movement disorder that had happened to me is something called tardive dyskinesia and akathisia. So these aren't terms that people generally hear. Um, what these basically are is movement disorders that happen as a side effect of medication. So, if you think of a movement disorder is basically an involuntary loss of muscle control. When it happens as a side effect of medication, what ends up happening is people with akathisia, myself included at the time, it literally feels like you want to crawl out of your skin. It literally feels like you want to rip your skin out of, rip your skin off. Like you can't sit still. The tardive dyskinesia point, it's kind of got this like tick-like movements, almost like chewing movements and things like that. So when I decided that I was no longer going to take medication, when I decided that I was done with pharmaceuticals, I was done with that side of things, that's when stuff really got difficult. Because it's when you stop taking the medication sometimes that these things can show up. And so that's what ultimately ended up happening. And about a decade or so ago, a little more than a decade ago, there wasn't a lot of answers on this. And so, when all of this was happening, nobody really knew what was going on, and it became quite a journey that I document in my book Unstill. So, today, so the way these disorders work ultimately is they go through a period of like there's the initial sort of like acute phase of something. So there's the initial sort of acute, difficult moment where it's 24/7, it's nonstop, for days on end. It was very much like that. Today, I'm in a much more, state where it's a waxing and waning. So it basically, there's good days, there's bad days. When you had asked me earlier about am I still on medication, the trouble with some of these disorders is you can't just stop taking some of these meds. You have to be tapered off of them very, very, very slowly. And for someone with a movement disorder, that can take upwards of months to years to decades. And so it's going to probably be a long journey for me in getting off of some of the offending medication because if you remove too much of the medication, what ends up happening is it can spark the movement disorder into more like a flared up state. And so but overall, I'm able to see patients. I'm able to see people in my practice. I'm able to, I'm able to work. I'm able to function. But at the time, it was a very difficult, torturous thing. hmm Sure. So, I really part of it was through this experience. I started off as an artist, a writer. Came to New York to, pursue my dreams on Broadway. Um, I did have quite a bit of success. I never want to downplay that. I had, success, but, unfortunately, I wasn't making enough money in the arts. I was dealing with some relationship problems at the time. That's what ultimately prompted me to see a psychiatrist. And then, what I really probably needed at the time was somebody to talk to. And it was through finding people to talk to and ultimately finding a really good therapist at the time that I was able to start to piece together some parts of my life and piece together moments, just things I wanted out of life and where I kind of wanted the next sort of direction of my life to go. And I actually fell in love with it. I started off also as a massage therapist. So I found that I've always been in a bit of a helping profession and it kind of was a natural transition just switching from uh massage therapy and acting to kind of now being on the other side of things and helping people to kind of work through their problems. So um a big reason why I became a therapist is because I just I loved the benefits that it did for me. I loved being able to kind of share something with, share my experiences in a space that was just for me, and being able to work through things. And I wanted to be able to provide that for other people. Mm-hmm. Yes, yes. So I did study. I went to school. I got my yep, got my degree from Fordham. So I decided that this is definitely a path I was going to do. But it was kind of through some trial and error, some ups and downs that I ultimately decided this is the path I really want to go. Anxiety disorders, OCD, yep, any of the panic disorders, things like that. Most common causes for anxiety, well, I would say general life stressors, but anxiety is one of those broad terms, I guess, that gets used today in society because there's all different levels of anxiety, right? So some people can have just very mild cases of life stress or anxiety. I tend to focus more on people who have very clinical forms of anxiety where they're really fearful about just everything in life. And oftentimes, the way I look at anxiety as a fear about a future that has not happened yet. So we're constantly living in this sort of space and this place where we're afraid of uh, the next thing that's going to happen, which creates all this worry, which creates all this sort of panic at the end of the day. Um, and ultimately, the biggest I see source for anxiety is ultimately fear. People oftentimes are afraid of a lot of things, or this anticipated fear that we see is going to happen. And so part of my job is being able to help people understand that that's not sometimes our mind plays tricks with us, and that's not how it really is. That's not how this really works. Sometimes we can get very lost in our minds, and it's just helping people to see that that's not necessarily the case. We can take a step back and look at things through a different lens. So, I've been a licensed therapist for about oh geez, when did I get my degree? So, it's been about a little over a decade now, a little over a decade. Um, Anxiety, though, I think I've struggled with anxiety my entire life, and that's part of my book as well. I talk about that in great detail in my book. Just my sort of journey with anxiety and how I was one of these people who was very much lost in my head and unsure of what to do, and yeah, but about it, yeah, a little over a decade that I've been practicing now. Hmm. 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 Yes. Sure. Sure. Sure.
And yeah, so now people should be hearing me. Anyways, that happens sometimes.
It does. It
that
does.
happens. That happens sometimes when it's live. Um, and thank you, Delin, for sharing that. Wow, that's valuable. So I guess I'm just gonna pick up where because we're here to connect. Anyways, maybe we can redo this in a few weeks, um,
Sure.
with complete audio and stuff. But I started practicing gratitude, like a gratitude journal, and it didn't really have much of an effect over, say, a couple months. But I don't really know the timeline. But I remember one day coming back from school at night. Perfect, it works now. And I remember coming back, and all of a sudden I caught a thought that I've basically never had before. And I just was like, wow, like I'm so grateful that there are street lamps in my town because I can see, like at night, because it was like late at night, I'm coming home. And I caught the thought, I'm like, whoa, like this gratitude thing like works. Like my brain is by itself now thinking about a street lamp, like being grateful for a street lamp. And this was before I started traveling the world and before I lived in places where there's no street lamps, where there's no roads and stuff like that. That came like much later. So I had really um no business or no point just thinking about being grateful for a street lamp. But because I've been writing down all of these things that I'm grateful for months or probably years even, my brain kind of it really reprogrammed my brain to be much more positive. So I started enjoying my life altogether so much more. So it really works, and it really
Hmm.
works. It doesn't work in the beginning, but it does really work. Um, so yeah, that's kind of a part of my story a little bit, struggling with social anxiety, overcoming it. And then I started a business and started practicing it and helping people myself
Hmm.
through the internet. So yeah.
Sure, sure. It's interesting as I listen to your story, I see a lot of parallels with my own. It's when you mentioned social anxiety. I think that was always something I struggled with as well. My family, I don't speak I don't speak the language, but my father and his side of the family is from Eastern Europe, Czech Republic. And so I'm certainly familiar with the difficulties that happen in Eastern Europe. And so, talking about some of the things that kind of led for your anxiety to kind of, grow and fester, I can certainly relate to my own experience with a lot of that. In terms of things that, difficulty with parents growing up, difficulty with, just school situations, things like that, and feeling like you're very lost and like you don't have anyone to talk to. But you mentioned two wonderful things that are very powerful for helping anxiety. Just gratitude and today we now have so many valuable resources online that people can turn to that for self-help, for guidance, for to start understanding what's happening with them and to start putting the pieces together themselves. I can certainly relate to that. When I was going through my big medical ordeal, I know that YouTube was a bit of a lifesaver
Yeah,
because I was able to start to see what other people were going through, and to kind of pull the pieces together and start finding the data, start finding the research when when the doctors couldn't. And so it's always wonderful to hear other people who decide to take control of their anxiety or their moments, and to be able to do something positive with it. And you mentioned something else that strikes me as talking about, kind of confronting your fears, because this is something I teach my patients a lot and teach people a lot is as scary as it can be, to take those first steps, like in talking to a girl or in, just confronting anything in life that really scares us. Once you teach your body that it's not as bad as you think, it's not as detrimental as you think, um, that can be such a life-changing thing for your brain, because now you've taught your brain that it can do something that it didn't think it could do, which will build the confidence, which will build self-esteem, and it kind of creates this sort of snowball effect where you're able to sort of now start taking on other challenges and you build upon that. So that's really how anxiety ultimately, it it never goes away, and we don't want it to go away. It will always be there on some level, right? But we can learn how to manage it so that it doesn't become this beast that sort of overtakes our lives. Um, and with the exception of very few cases, most people I see, I don't think they need medication for anxiety. I think just having some skills, having the tools, um, having the proper, people to guide them, oftentimes that's enough, because you know, we it's wonderful that you were able to do so much of that work on your own, and I think oftentimes, at least here in the US, uh, a lot of people, with the way our healthcare system works, sometimes we're forced to do a lot of things on our own as well. So the internet becomes our friend at the end of the day.
yeah. It was kind of on my own. Of course, I did a lot of learning from other people, and
Sure.
these like online forums or Facebook groups or whatever they were, like social anxiety groups online, were very helpful
Hmm.
for me because I could connect with other people, and I saw that there were other people who were struggling. I saw that there were other people who did some things and got better, right? So they gave me more hope and they gave me more motivation. So it wasn't like completely alone, just like, okay, I'm just gonna,
Hmm.
figure this thing out by myself. And but yeah, I definitely tapped into the social side of the internet, which is a whole other topic that we might be able to get into maybe next episode or something. Being
Yeah. Well,
social
I
on
will tell
social
you that.
media.
Yeah, so that's for anxiety and for anxiety's purposes. That's one of the things that ultimately helps with anxiety is having connection.
Yeah,
And whether you find that through an online forum, whether you find that through a therapist, whether you find that through somebody, just a friend that you have that you can talk to, having a resource like that in your life, because what that teaches you is that you're not alone, you're safe. There's other people struggling, and that safety allows our anxiety to die down, and lets our guard down a bit and gives us the power to sort of say, you know what, I can go a little bit further.
yeah,
So it's a very important thing that when we're talking about anxiety.
yeah. I like that you highlighted going into the fear or like fighting against the fear in a way.
Hmm.
I think this is probably the biggest mistake that people make, like when it comes to social anxiety, is that they try and hide away from it, right? Like I've seen so many people and so many times of like questions like, what is the best job for somebody who has social anxiety, for example? I'm like, well, um, you could do maybe do this on this and this, but however, like your goal should not be trying to find a job or mold your life around social anxiety so that it controls literally even the job you have, right? Or
Mm-hmm.
the where you're going to spend most of your life, basically. Your goal should be to overcome the social anxiety or get it under control, learn skills, reprogram your brain, get a better support circle, whatever you have to do, so then it does not control the quality of your life. But most people don't do that. They kind of try and hide away from it. They're like, okay, I just have this thing, and then they get the labels on it, social anxiety disorder, right? And then
Yeah.
it can be just like, I have this thing and I have to create my life around it rather than I'm gonna go through it so that it doesn't control my life.
Yeah, absolutely. Absolutely. Getting people to confront the fear at the end of the day can be one of the hardest things because that's what the anxiety ultimately wants you to do. And if we look at anxiety, it's not it's not a bad thing, okay? It's one of those things. I like to look at it kind of like a scared puppy dog. um
Okay.
it really is just, it doesn't know how to speak to us. It just barks at us all day. It barks, it likes to yap at us, and we just have to learn how to speak with it on its language. All anxiety is really doing is it's basically a signal that our body is creating, saying something might be wrong. But unfortunately, we live in a world where, um, okay, yes, you might, people might not like you if you're at the party, but they might also like you. And so we've got to teach our brain how to find more evidence to that. And so when you confront the fear, which I know it's so difficult for anyone struggling with anxiety because taking those first steps can be really challenging. Um, it can be so difficult. And then, like you just said, what ultimately ends up happening is it ends up taking over a person's life. So now we're not just, now we're letting the anxiety run the show. Now we're letting it drag us around. So now the puppy dog is, saying, I'm going to control your life, as opposed to us saying, nope, I've got you on a leash and here's your place. A lot of what I teach people, you know, um, in the work I do is, it gets a very bad rap because it's a very old school type of therapy, but still very effective for anxiety and OCD is something called exposure therapy, which is where you slowly start to work your way up towards building towards like your fears. So a lot of people think like I'm going to throw spiders on them and they're going to just sit there with spiders on them and that's going to be the end of it. But what it really is, it can be simple things like, okay, you know what, if I'm afraid to go to like a party, then maybe I start by just talking to some people online, and you start to gradually work your way up and do things that will ultimately, get you to that point where you're able to go to a party. So a lot of the work we do in that regard with anxiety is helping people not to run away from the fear, but learning how to feel the fear and feel their way through the fear. And that's part of what I love about being a therapist. And I wish someone had told me decades ago, is you're gonna have to feel some of these things. You're gonna have to, everyone wants to run from the feeling of anxiety, but if we can learn to actually be present with it and not hate it and not judge it, but learn how to sort of accept it and tolerate it, we can actually do more than we think. I'm sure you've experienced this with your anxiety. I can certainly attest to it for myself. Even when we're anxious, we can still do things. We can still do things. We
Yes.
may not want to do things. Um, but if we do things and we push through that a little bit, you find out that that anxiety does end up settling down.
Yeah, absolutely. I think it's absolutely vital, and in order to really get it under control, there's no way around exposure therapy. At least
Mm-hmm.
that's what I've seen. Like, I've seen people spend 10, 20 years in different kinds of therapies, different medications, still have depression and anxiety. I've seen
Mm-hmm.
people I've seen people do hypnotherapy, I've seen people do NLP, I've seen people, and it makes them feel better for a week or so, but like it's still there. And I do believe until I'm gonna see something like, oh, this thing like really worked for many people um for an extended period of time, not just made them feel better in the moment, then
Mm-hmm.
I'm gonna be like, okay. But I think exposure therapy has to be some, at least to some extent, has to be a part of it. maybe
Yes.
for general anxiety, I think too, but specifically again for me, social anxiety, absolutely. And it's been a big part of my journey. It's basically what every one of my clients kind of goes through, and I've created this metaphor or this analogy or this perspective of a video game, right? So let's say somebody who's really anxious and their goal is to be able to go in a coffee shop and ask for a girl's number, just to have a
Mhm.
clear example. Or let's say go to a networking event and connect to and go speak to the speaker, like if somebody's on the stage, they share their story, whatever, and you want to go and connect with them so you can start a business relationship, right? Either of those goals, either if it's a more so romantic interest or a business interest or whatever, or just making friends, right? That's your level 10, and you are at level 1. You're not able to go, you're not able to say hi, you're not able to wave at somebody, right? In a coffee shop. Well, then you kind of can deconstruct it as in like a video game mindset, because what do you do in a video game? Well, you don't go from level 1 directly to level 10, because you're gonna probably get your ass kicked by the boss and you never want to play the game again. And I've seen people do
Mhm.
that as well sometimes, where they just go like, oh yeah, I'm just gonna like push myself to do it, and then they stumble, they embarrass themselves or whatever, they make a huge kind of mess in a way, and then they're like, oh, that was
Mhm.
so painful, why would I ever want to do that again? But with exposure therapy, a big part of it is doing the thing over and over and over and over again until your brain really gets it, right? That, oh, this is safe, this doesn't really matter that much. So if you fail miserably, you're on your first attempt and it hurts so bad that you never want to do it again, that's a problem. So you start with much smaller, right? You start with level 1, you start with level 2. Like you said, maybe message somebody on Facebook, or on social media. You can start anonymously. That's how I started, right? Like my steps, my levels were going and talking to people anonymously on online forums. Then I started using my name in chat. After I was able to have some chat, I started sending voice messages. Then I started
Mhm.
sending some video messages. Then I started doing phone calls. Then I started doing video calls. After gone through all of this, then I went to speak to girls on the bus on my way to school,
Mhm.
right? So it was definitely a process. It wasn't just like out of nowhere, I'm just gonna be like, you know what? I'm just gonna go talk to somebody on a bus. Like there was basically no chance for me to do that. It felt impossible. But talking to somebody on online and doing this, and then maybe voice message later, and it kind of went these levels, right?
Mhm.
And each level is like a little bit outside of your comfort zone, and you gain confidence, you gain experience points, you gain skills that you can then grow. You upgrade your character, right? Your mind, your body, and then you can do the higher levels.
Yeah, absolutely. Absolutely. It's and when you're able to do that, you'll start to see, excuse me, you'll start to be able to see a lot of changes, just naturally happening in your life.
Yeah, you said it's old school, and it gets a lot of criticism. You said so.
It
What's
does.
what's a modern replacement?
Okay, so if you look at behavioral therapy, which is what this kind of falls under, back in the old days of therapy, the idea was that they would literally throw you in like the fire pit and say, okay, now we're
Uh,
going to get over your fear of fire. Um, so it comes from some very primitive roots in that regard, and that's
right.
why it has kind of morphed and developed over time where we don't do as much of that. A lot of therapists kind of shy away from exposure therapy because it does require that it's like a very hands-on therapy.
Mm-hmm.
So a lot of times you can't just sit there and, like with my sessions, we're not just sitting there and talking about, your past and all of that. We're going out into the field and doing things. Um, so yes, I have people who I do sit and I talk with their past about for things like trauma and stuff like that. But when it comes to like exposure therapy, it's a very hands-on type of therapy. Um, and so, a lot of times, as therapy has progressed over the years, we start to get different ideas, different philosophies, different modalities sort of coming into it. You mentioned a couple of that, and sometimes the tried and true methods are the same. Most of the behavioralists believe that if we change our behavior, the the anxiety will start to lessen.
Mm,
The anxiety will start to diminish if we change our behavior. They, you know, that's kind of like the old school sort of belief. A lot of the modern behavioralists say, okay, listen, we've got to work on a lot of different elements, but we still need to address the behavior, right? We still need to address like what you're not doing. We still need to address the thoughts in your brain that are keeping you held back. And so that's it is evolving into something. It just doesn't. I think a lot of therapists do like to mull into the, you know, all of the issues that sometimes can keep people in therapy for years. My philosophy is I want to get you in, I want to get you out. I'm not trying to keep you for the next 30 years. I want you to feel confident to be able to go out there and take action, take control of your life versus
nice.
you need to come and see me for the next 30 years and this is
Yeah.
going to be your blanket forever. And so I'm not afraid to kick people out of my off of my couch.
All right. Yeah, I think that's very important. Not wanting to keep people for 30 years, right? Because then, yeah, it's just I've seen that so many times, and personally, the work that I do and the work that we do with clients is on like two pillars, right? Two pillars of progress, two pillars of healing, whatever. It's internal work and it's external work. Internal
Hmm.
work is looking at the past, of course, right? What's the story there? What happened? What associations have you created, right? Why does your brain have a more severe response? Because let's say social anxiety, I believe that everybody, literally all people, have some degree of social anxiety. And so we look at why your brain specifically reacts in a more severe way, right? Why the level of anxiety is severe, and we go through the understanding and do some reframing as well, just mental reframing, and do some internal work, try and change the associations as well. For example, to rejections, like what does it mean to get rejected? What does it mean to get judged? A lot of or some of those, and then the external is just plain exposure therapy, going out there and doing, starting by smiling and waving at strangers, for example. That's been a very successful exercise with a lot of my clients, that kind
Hmm.
of starts building the momentum in the beginning. And again, very specific to social anxiety. And
Sure, sure.
yeah, so that's kind of how we operate, how I operate, and how my clients make a lot of progress with the two
Yeah,
pillars.
absolutely, absolutely. Um, you know, and I have similar approaches in my practice as well, where, you know, we tackle, you know, you can't ignore the past because that's what kind of got you here. But, you know, you can't ignore the present as well, and you can't ignore the behaviors in the present. So, you know, and I will just tell you that, you know, when I work with my patients, it's, you know, having gone through the experiences I've had with the medical movement disorders and stuff, I'm not as inclined to refer people out for medication unless they're really on the severe side of things.
Gotcha.
Like I like to leave that as like a last resort option for people because um you know, once you can teach people to kind of overcome the fear of something, it really does just change so many other elements of their life. So, yeah.
Yeah, awesome. Yeah, and it does change the brain as well, right?
Hmm.
It definitely starts to rewire the brain patterns and all of this, and it gets so much easier once you've practiced that a bunch. So I'm
Hmm.
really happy to hear your approach, and I very much agree, and I'm super happy that there are people like you out there, because I've met so, like, it's so sad to me. Like, I have a lot of clients who come to me, for example, and they're like, I've been 3 years in therapy, I've been doing, and I felt like I've heard so many stories when people are like, well, I went to therapy to like talk it out maybe a little bit, have somebody to listen to me. And they didn't even want to hear my story. They just said, oh, okay, you have anxiety. Boom, take this pill. Right? Like,
Mm.
first thing, I'm like, what? That's wild. They didn't even hear you out. That's crazy. And then, so,
Yeah,
um,
I will say
really
that.
happy to hear.
Yeah, I will say that, you know, this was something I didn't understand at the time, and I think this is what kind of sort of got me in my trouble with the medication and how the movement disorder ultimately progressed. Because, at the time, I didn't really know who to talk to.
Yeah.
And I just figured, oh, a psychiatrist, well, that's what you think of when you hear talking to somebody. And I don't know how it works over in Eastern Europe, but I know that in the US, there's very big distinctions between psychiatrists and then other mental health professionals. And psychiatrists here are really just meant to prescribe medication.
Mm.
And so when people think they're going to somebody to talk about their anxiety, and then the doctor says, oh, well, let's just put you on this pill,
Wrong doctor.
that's kind of what got me into my trouble because I'm like, oh, okay, well, maybe she's right. Maybe this person's right and I should try this. When my gut was ultimately telling me that I probably should just talk to somebody. Um, but it kind of led me down this path, and I talk about it in my book. How it sort of led me down this path of ultimately, developing a movement disorder because of it. But I don't think enough people get educated on just what the different types of mental health professionals are out there, and so it leads to a lot of confusion, and then people are left not getting the right kind of care at the end of the day.
Yeah. I'm curious as well, and again, like super happy and inspired that you share your story with, the medication struggle and all this. How did it come about? I'm sure you go deeper into the book, but like you said that your gut was going with, oh, maybe I just need to speak to somebody, maybe I can figure this out in other ways. Were you searching for that and then just kind of by accident found a psychiatrist, or was that like kind of the system led you in there, or
So, what ultimately ended up happening is I started developing a lot of stomach pains, and as people who have anxiety will know, you can get all sorts of physical symptoms in your body, right? Anxiety doesn't just affect the mind; it affects the whole body. And so, for me, it started off as stomach issues.
Mhm.
And being stubborn and younger at the time, I was like, well, this must be stomach problems, so let me go talk to somebody who deals with the stomach. And, they were able to prescribe some medication, which ultimately ended up being one of the culprits that started the movement disorder off. I should
Mm,
say that this is not just
okay,
limited to mental health medications.
okay,
Um, there are stomach pills that do this as well, cause movement disorders. So it was through seeing them that I first started. And here's the trouble: when you're feeling very anxious, so I was feeling very, my career wasn't going the way I wanted it to. I was having difficulties with my partner. I wasn't sure what I wanted to do next in life. I felt very much trapped in my head, and I knew I needed to see somebody to talk to, or I knew I needed to talk to somebody to kind of figure this out. But I didn't really know where to begin my search. And so, you search for, in the US, you have to search, through your insurance provider, or you have to look online to see what providers are accepting new patients. And, it was just, the idea is like, oh, just see a psychiatrist because this is the person who's going to help you at the end of the day. I didn't understand all the different distinctions between mental health
mm,
professionals. So in the US, we have psychiatrists, we have psychologists, we have social workers, we have licensed professional counselors, we have life coaches, we have all different sort of titles behind these things, and it can be very confusing for the general public. Um, Many of them can do the same things, but I just happen to pick the one that just prescribes medication. Um,
right,
and so, I did eventually find a very good therapist who was able to help guide me and to help, that's kind of what I wanted in the first place. But by that point, it was too late. I was already a part of this medication system
yeah,
that ultimately ended up, taking bits and pieces of my life. And so,
gotcha,
um, but yeah, that, and in terms of just my anxiety overall, I mean, I make no I don't hide it in my book, but I certainly had a difficult relationship with my mother growing up. I certainly had a difficult time with her, and just issues that I think a lot of people still face. Just struggles with identity, struggles with what I wanted, career, all that kind of stuff. It really just sort of um, it really just kind of compounded at one point, and I'm like, what am I doing? What am I doing with my life?
yeah, okay, yeah. I think in my country, from what I understand and from what I remember, we have, of course, all the other people like life coaches and all of this kind of independent people, um, kind of
Hmm.
separate. But as a part of the system, there's psychologists and psychiatrists, right? Very
Hmm.
similar to you. Psychologists are like more like so the therapist and just talk to you, and then the psychiatrist is the one who's just gonna give you the pills. And from what I understand, if you're having mental health struggles, first they send you to a psychologist, like as a part of like a process. So that's how it should be. I'm not sure if there's any cases that people kind of go around it and they don't follow the steps, or um, and then so the psychologist will kind of evaluate you, maybe give you maybe give you a session or two, and then say, okay, you should go to a psychiatrist. Usually that's very fast, where they go like, oh yeah, okay, you have anxiety and depression, so you go to the psychiatrist and just get these pills and whatever. That's and this is where it gets really interesting in my perspective and in my as a part of my story as well, because and I found out like years and years and years later that one of my classmates had very similar issues, and we became somewhat friends. We used to play a lot of games. We never really went out because we were like super anxious, but we would play games together. So we became kind of sort of like video game friends. And I found out like years later that he was actually seeing a psychologist and a psychiatrist as well, and he started using medication, and he got a little bit better as he grew older. But then the difference between now my life and his life, or the difference between our mental health states and like even levels of life satisfaction and confidence and being able to talk to people and communicate and build relationships with other people and operate in the world, there's a big difference, right?
Sure.
There you can see a big difference. So I went the self-help route and I got obsessed on that. He went the system psychiatrist, medication psychiatrist, psycho. I don't think he uses the medication anymore. Um, but he's basically very isolated. He has a small group of friends who are basically just weed smokers, right? He has a job that he hates, complains about the world mostly, and this and that. So I kind of had to distance myself because I was like, I'm building a business. I'm gonna be traveling, right? And I developed this like really positive mindset, and so it definitely created a huge difference in the results that it generated in our lives. And I think it's important, I think, to highlight this as well sometimes. I actually
Yeah.
haven't shared this many times, but I think it's important to highlight this to so that people see the contrast. And I'm not saying that don't go to therapy, don't go to psychiatrists at all. Like, yes, but also don't say, oh, they're just gonna help me, they're just gonna save me. It's like you have to do the work yourself, right? You still have to conquer the you still have to face the fear, feel the fear, and do the things anyways. You still have to grow. You still have to learn. And yeah,
Yeah, absolutely. Absolutely. I think oftentimes so much of what happens in healthcare, I think across the world is, you know, that people get sort of trapped into a system. And if you don't, you're putting your faith in professionals and, trying to have them help you, trying to have them guide you on some level. And really, it's a luck of the draw. Some people get really good professionals and they have a positive experience and it ends up working out well, and some not so much. Um, and there's just unfortunately no way to know. But I think a big thing I try to highlight for everyone and for my book and for just anyone seeking mental health treatment of any kind is you need to be a patient advocate. You need to be an advocate no matter what you're struggling with, no matter what you're dealing with. This goes not only for mental health, this goes for physical health. Um, we need to start holding our doctors accountable, and we need to start holding professionals accountable to things, so that so that we're not going to take it. We're not going to take it anymore. It's we have to be an advocate for change. And so, if you're going to see a psychiatrist or you're going to see a psychologist, any mental health professional, interview them, make sure they're the right fit for you. Don't be afraid to ask the questions. This is the person you're going to be either talking to, working with, whatever. You want to get a better sense of who this person is and how they're going to help you. Um, and ultimately, if you're not feeling it, if your gut's telling you, this may not be a good fit for me, then I say run, and find someone else, because there are tons of wonderful source resources, great people, uh, you know, things that can be done now. Where you don't just have to just go with what the old school way of thinking about things was. There used to be a time where, older generations I know, you went to the doctor, you trusted what the doctor said, and what the doctor said goes. I think with your generation, my generation, other generations, we're starting to see now that people are a lot more willing to question the system, challenge the system, and not so much afraid to just say, that doesn't make sense.
Yeah.
So I really teach patients to be their own advocate as well, and that's one thing I really try to highlight in my book is you can prevent a lot of what happened to me if you just take the time to ask a few questions, if you take the time to ask the right questions, and you don't look at the doctor as God.
Yeah, I like that. I really think that's a big highlight as well. Don't look at the doctor as God, and that goes for anything. Like some of my favorite stories that I've people that I've interviewed, or people that I've heard, and people that I've met, where they got diagnosed with a terminal disease, cancer, or something else, and the doctor said you have this much time to live, and they said, um, the best quote that I heard was, "Thank you for your opinion, but I will not accept your verdict," or something like that. Very much
Hmm.
paraphrasing it, right? And they went on to overcome it while they had, basically based on doctors, no chance of survival. And I've met many, many, many people like that. So yeah, I think it's very important to take your own life into your own control a lot of the times, and don't just be like, oh, they're just gonna save me, and whatever they say, just that's how it has to be.
Yeah, absolutely, absolutely.
Amazing. Well, this has been like a very important and a amazing conversation. And what is the name of your book, and where can people get it?
Sure. So the name of my book is Unstill. Um, you can find it on Amazon. You can find it on Audible. If you don't read books anymore, you can read it or you can listen on Audible. If you go to my website, lennygallo.com, I've listed all of the sort of most affordable versions for however you read books, whether it's ebooks, um, really pretty much anywhere you buy books. I know Amazon is the big one these days. So you can go there, type in Unstill Lenny Gallo, and it'll pop right up. And I want to thank you so much for having me. This was wonderful.
Yeah, I think we can definitely do a follow-up. I see it. Obviously, I think my sound wasn't working for like the first 13 minutes. You spoke most of the time and you shared your story, so mostly it was fine. And there were three, four people listening in at the same time, like while we were live. Um, Apparently somebody said that it was lag, that there was some lag as well. But sometimes technology, that it is what it
That
is.
happens.
You gotta roll with it anyways. I'm super happy
Yep.
to have met you, and I think this conversation still had a lot of impact. There was some, I see some comments over here saying, "Yes, we have to be our own advocate. This is what I'm trying to teach my children." And somebody else said, "I absolutely love this discussion." So yeah, I think this is very important to have these conversations, especially in this day and age. So thank you so much for coming on and taking the time, writing the book, and sharing your honest story. Amazing.
Thank you. Thank you. Will you be able to send me a link so that I can share
I
it on
will.
mine as well?
I will. Yeah, I'll do that
Okay.
like right after. I'll just end the stream and then I'll send you the link to the recording. I think it takes maybe